Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's conference for the latest COVID-19 information for the Amarillo community. Let me go ahead and introduce who is on our panel here very quickly. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest, Dr. Michael Lamentier, Chief Medical Officer for BSA, and Dr. Rodney Gonzalez, Director of the Amarillo VA. We'll open it up to statements from our panel, and then we'll take questions from our media who are in attendance today. We'll go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm doing well, Dave. Thank you so much. And hello, Amarillo. Hope your week is going well. It's hump day, and if you don't know it, the Amarillo Zoo has a new camel, and her name is Daisy. So I'm going to call today Daisy Day, and hope that you're celebrating the middle of your week and you're 1 minute closer to the weekend, which is always a good thing, right? So we're still talking a lot about vaccines here in the city, and Casey's going to give you the specifics on how we're adapting our vaccine programs and our clinics. But what we want is for everyone to have access to a vaccine. I want to remind you it's free of charge, and we want to make it as easy as possible for you to get a vaccine. We are celebrating in the Nelson family this week as the last member of our immediate family. Our 16-year-old is getting his vaccine this week. So I want to make sure that he's vaccinated for all the summer camps and things that he wants to do this summer. And I know as a mom, I'm not going to worry about him getting COVID, and I'm going to have all of the freedom to send him different places to stay overnight with different people and do camps, because he will be protected. His vaccine will be fully, he'll have the full effect of his vaccine by the time he starts doing those camps. And it will help us in vaccine protocol or in COVID protocol. It will help him have more access to more activities. So from a parent's point of view, I am very supportive of the vaccine, and knowing that my kiddo will be protected and my kiddo will not be part of the problem in spreading COVID as he goes about his summer activities. I have had questions from citizens about ethnic and racial data in our city for people who've received the vaccine. Obviously, we have access to that data for people who've gotten vaccinated at the city clinic. But we know that's not everyone in the city. A lot of people have been vaccinated at local pharmacies, at maybe hospital workers definitely vaccinated in their hospitals. Texas Tech has vaccinated the public. Maybe you went to your doctor's office and got a vaccine. So we know there are lots of different places that you can get a vaccine in the city, and we don't have access to all of that data. Only the state of Texas, Department of State Health Services, has access to the entire city's vaccination data. And so we've requested that data from the state, and we have not yet received it. So we're in this waiting period where we don't have a complete set of data for who has been vaccinated and how it breaks down ethnically or racially or even by gender. So I just want to answer citizens that we've asked for that data, and as soon as we have it from the state, we will share it with you. And I can't answer for the state as to why we are having a delay in getting it. I think it's just related to no one expected a pandemic, and we didn't have information systems in place to process all that. We've emphasized actually doing the vaccines over the data collection. I mean, they're collecting data as they give vaccines, but processing that data and actually getting it back out into the public to for them to look at and understand is a slower process. So I wanted you to know that we're working on that, and as soon as we have that information, get it out to you. That's all I have today, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm good, Dave. Thanks. I'm glad to be here this morning. We'll talk about our numbers like we do each week, and then we'll talk the mobile clinics because have so far been wildly successful. So we're super excited about that. And so as of yesterday, there were a total of 34,065 cases of COVID-19 reported in Potter and Randall counties, 17,351 cases in Potter County, and 16,714 cases in Randall County. We have a total of 32,890 recoveries, and we do have 742 deaths to report. That leaves us with 433 active cases. The 7-day rolling positivity rate is currently at 4%. The positivity rate at the drive-through testing site is at 26%, and the 5-day new case averages at 37 new cases per day. So you can see that those cases are going up. As our masks are starting to come off a little more, our cases are going up, and that was certainly to be expected. So just want to give you a reminder that for status level yellow, that we are seeing those cases increase a little bit. So please remember, prevention is the key. Masking, social distancing, staying home when you're sick, and vaccination are the tools that we have in this fight against COVID. Yesterday, our GA34's hospitalization percentage was at 2.94%. So that means that just under 3% of all hospitalized patients have COVID-19. Again, creeping up just a little bit. So we want to make sure that we're protecting our hospital capacity and making sure that our healthcare workers have all the tools that they need. So again, that masking, social distancing, hand washing, staying home when we're sick, all of the things that we have done for so long are things that we continue to do. The public health drive-through testing site does remain operational. Individuals can call 378-6300 to be screened and directed to the test site. The vaccine clinic does still remain operational at the Civic Center's second entrance number 2. Today we will be open until 5 o'clock. For clinic times and other great information, AmarilloAlerts.com is still the best place to go. And remember, all adults are eligible for COVID-19 vaccines. So anyone 18 and over at the city's clinics, since we have the Moderna vaccine, is who we can vaccinate. To date, Amarillo Public Health has given 73,489 first doses of vaccine and 55,123 second doses for a total of 128,612 doses given. Last week, first mobile clinic at the Warford Community Center, and it was a huge success. We saw 241 people and could not be more pleased with the turnout. So thank you to everyone who came. Thank you to the community, and thanks to the staff at the Warford. Such a great success there. We do have a slight change in plan because our goal is to always take care of our community in the very best way that we can. Since we still had a number of people who came to the Civic Center expecting us to be open last Wednesday and Thursday, we are going to stay open at the Civic Center. So this week we're open today, and we'll be open tomorrow at the Civic Center. Our times are our regular times, 9 to 5, but we're also going to do our mobile clinics. And so now we have the capacity to split our team so that we can serve at our walk-in clinic at the Civic Center, but also offer the mobile clinics. So remember to come see us tomorrow at the El Alamo building at 1502 South Cleveland from 10 to 5. We'll be there ready to serve, and we're glad to see you. So thanks for our community and all that we've done during this time.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
Good, thank you. I have an interesting just piece of data that I saw that was brought to my attention out of a journal called Medical Economics. And this was done a couple of months ago. They actually polled 3,000 physicians about their attitude and whether they had been vaccinated at that time. And at that time, more than 95% of the physicians were polled had been vaccinated, and most of them had been vaccinated as soon as they could possibly get it. So I think that's a really important piece of evidence that really does suggest that for physicians, most physicians, almost all physicians, are very much in favor of getting vaccinated. And I hope people pay attention to that. And so along those lines, I think this morning I would just like to ask the physicians in the community to speak personally to your patients about getting vaccinated. I think we need to remember how powerful it is when physicians take the time to sit down and speak to their patients about not only their individual problems, but how to protect them and how to practice preventive medicine. And at this point in time, it's really important, I think, for the physicians of this community to try to reach out to your patients, and those that have not been vaccinated or those that are reluctant to get vaccinated, to talk to them about the benefits of that, and really communicate the importance of getting vaccinated. That's all I have to say this morning, David.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hi, good morning, Dave. So I'm excited for our community. I want to personally congratulate Mayor Nelson and all her colleagues for a very successful election. And I know that great things are going to continue to happen for Amarillo. So yesterday I was on a meeting with the Texas Department of State Health Services, and they put out a lot of numbers, and there's some really encouraging numbers I want to share with you. So in total, there's been about 2.7 million cases of COVID in Texas, and that has resulted in just shy of about 50,000 fatalities. Now, that's the bad news. Now, the good news is, as of yesterday, there were about 2,600 hospitalizations in Texas related to COVID, and that amounted to 5 to 6% of the total hospitalizations in Texas. Now, 2 weeks ago, that was 10 to 11% of all hospitalizations. So we've almost halved the number of hospitalizations required for COVID in Texas in the last 2 weeks. Now, the other good thing is that 11 million Texans have received at least one shot of the vaccine. 8 million are completely vaccinated. And that's critical, because if we're gonna win this race, if we're gonna win this war, that is an essential part of it. So it's a lot of Texans who have already been totally vaccinated. Right now, they've had about 2,000 cases in Texas that included one of the variants of COVID-19. And some of those are variants of concern, so about 2,000 cases. Now, the interesting thing was, and I should say that 90% of those variants are the UK variant, the B1117, that's now spread all over the country. In fact, countrywide, it amounts for over 50% of the cases of COVID-19 right now. Now, here's the interesting thing. They looked at a multi-site study at vaccinations. What they found in people over age 65, and those that had received 2 vaccines, it prevented over 94% of expected hospitalizations in that age group. So that's incredibly powerful. If over 65 individuals got one of the vaccines, it still gave them a 64% protection against being hospitalized relative to what would be expected. So, as Dr. Milton's saying, we've all said over and over again, these vaccines are incredibly powerful, and I believe they're incredibly safe. I think they're some of the cleanest and neatest vaccines we've ever seen in the history of science. So let's talk a little bit about, I should say, one last thing they announced is they anticipate within the next 2 weeks that the FDA will approve an EUA for vaccinating children between age 12 and 15. So we're moving to even lower ages now to be able to get our children vaccinated, as the mayor was saying, so for their activities in school and outside of school. So let's talk about the numbers in Northwest. Well, we're seeing the same good news that the rest of the state is seeing. So we've got 185 patients on the acute side today. That's a little lower than our average census. Only 9 of those patients have COVID. So that's 1.8% of our hospital capacity right now is going to COVID. We have 30 people in the ICU, only 4 of which are suffering from COVID right now. And of the 15 ventilators in use today, only 3 of those are being used for patients with COVID right now. So great numbers. In terms of our outpatient testing, yesterday we had a 5.3% positivity rate. We have stayed below 5% for about the last month every day. So again, the numbers are very encouraging there. The good news is, for the first time since March of 2020, we have 0 employees quarantined, and we had no one call in sick today. So again, that's just incredible in terms of our staff and being able to maintain our staffing at the hospital. Now, we did have 3 patients lose their lives in April because of COVID-19, and that's a tragedy for those 3 families. But well, that's a far cry from where we were back in November and December. We were talking 70 plus fatalities a month. Now, with regard to remdesivir, right now we have 2 patients in the hospital receiving that medication for COVID-19, and we've treated a total of 766 patients. Now, we're also using on an outpatient, we're using a combination of antibodies. We have the bamlanivimab and the etazivimab. Now, we're calling that combination BAMIT. And we've treated 1 patient with BAMIT thus far. It's interesting, we have sent all our positive tests to Texas Tech to look for these variants. And right now we have gotten 7 tests come back for 7 variants. Okay, and those include the UK variant, a California variant. We had 1 that was the Brazilian variant. And then interesting, we had 1 that was the Indian double mutant variant. Okay, and that is the variant that is really ravaging India right now. So we have actually had 1 of those in the community documented right now. So just in closing, last week I was attending the virtual meeting for the American College of Physicians. And the first morning there, they had a live interview with Dr. Fauci, who's always been my hero. And he actually received the ACP's Community Service Excellence Award. But one of the questions they asked him, they said, Dr. Fauci, was there anything that we could have done differently that could have changed the course of what we saw in the United States? And his thing was that he thought it was somewhat the breakdown of the public health department network in the United States that resulted in a lot of the problems we had. In fact, he said, if you looked at communities where you have a strong public health department, these communities fared very well. And that's what we saw in Amarillo. We have a great public health department. And again, this is what Dr. Fauci was saying, is we've got to reinforce the kind of network that Casey and her team have to help support community health. So I know they were honored last week at the Good Scout lunch, and it was well deserved. So congratulations on that. But I think Dr. Fauci said we've got to move back to being ready for the next pandemic when it happens. So that's all I have for today. Thank you so much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Good morning, and good morning, Amarillo. A lot of positive things have been going on over the past couple months, as have been mentioned by some of our leaders in the medical community and the city leadership on this call today. And that is that, we're seeing less numbers of patients hospitalized. We're seeing more individuals get vaccinated. We're seeing Amarillo open up and folks be able to get back to some more of a sense of normalcy, I'll say, in terms of doing things that are socially important in terms of your mental health and growth as an individual outside of the workplace. We can't just work all the time, although sometimes it feels like that's what we're doing. So it's important to have that collegiality and the ability to socialize and be with friends and family. With that being said, we just still need to be smart. And I think the number one thing when we say be smart as an adult is you need to get vaccinated. And if you're not vaccinated, you really need to think about why you're putting yourself at risk, why you're putting others at risk. The most common reason I hear now for people not getting vaccinated is, well, I just want to wait and see. And I guess without trying to be really offensive to individuals, I'm really saying to myself, wait and see what? Wait and see if you're going to get hospitalized. Wait and see if you're going to get one of your family members ill. Wait and see if you're going to get somebody exposed that's immunocompromised that and that you potentially are around. Why would you take that risk? The evidence to date has been extremely positive in terms of the safety of these vaccines. Even with the cessation of Johnson & Johnson for a transient period, as we all know, that vaccine is now back available to be administered. And I think out of an abundance of caution, and properly so, there was a transient pause just to make sure that some of the very rare complications that were being seen were not having something else about them characteristically that were making us think we needed to hold off. Well, obviously, we have a lot of intelligent people in this country in the medical community that are helping to make these decisions about whether a drug is safe to move forward, whether a vaccine is safe to move forward. And clearly, the decision was made to say, yes, we're going to save lives if we do this. We think about our colleagues across the world and how bad things are right now in India, for instance. And, our heart goes out to those individuals and those families who really have not had the access to vaccinations. So think about that when you have the opportunity to get vaccinated and make a determination about why you're saying no potentially. And we understand that there are certain situations where you can't, if you've had an adverse reaction to the first dose or something else about your history has led to anaphylaxis around a vaccine. We understand some of those rare circumstances, but that is the minority of individuals in terms of those who are eligible. I think when we have the availability for our younger citizens, teenagers, young adults, and also potentially pediatric patients younger than the age of 12 in the near future, we also need to think about the benefit of vaccinating those individuals and what that's going to mean for us in terms of, again, getting back to a sense of normalcy. At BSA today, we have 21 patients hospitalized. And I got to tell you, that gives me a little bit of pause. We had a fairly long period of time where we were running around 10 patients, 7 to 12 in that range. Now we're kind of creeping up a little bit. We're back up at 21 patients. And what we're seeing when we talk to our clinicians that are managing these patients in and out day and day is that none of these patients are vaccinated. If patients are admitted with COVID-19 and they've been vaccinated, there's usually something else going on. They have a history of immunosuppression. They are on drugs or have medical conditions that are causing your immune system to be weakened. And they still are benefiting from the vaccination. I would guarantee in terms of the severity of their illness, they'd probably be in a worse state if they weren't vaccinated. But again, we're not seeing people that have been vaccinated come to the hospital. In addition to that, we have very few of our employees now quarantined. We've had weeks where we had 1 or 2 or 0 employees quarantined. Today, we're up to 7 employees quarantined. All 7 of those individuals have not been vaccinated. And there may be good reason. That's not the point of that. My point is to say that if you can get vaccinated, you don't have a contraindication, I want you to strongly reconsider why. And again, those individuals who are not are the ones that are getting ill, that are requiring, in some cases, hospitalization. And in some cases, they have severe disease. We have now as well, Brian Weiss, Dr. Weiss mentioned that they have had a few variants detected. We now have had our first variant detected at BSA. This is a USA variant. It is not a variant of interest or a variant of concern as defined by the CDC. And it's not surprising, again, that we have these variants in our community. What the concern about that is that obviously, as we get the potential for more and more mutations of this virus and different variants, some of those variants are going to be of interest or concern or of what they call high consequence as defined by the CDC, which potentially would lead to a second wave of this or third wave of this pandemic, if you will. We've kind of had 2 bumps here in Amarillo, as we know, last spring and then this past fall. We don't want a third bump. The potential for that, I believe, would be in a segment of the population who has not been vaccinated and the potential for increasing numbers of variants causing significant disease. So again, properly attempting to mask in certain situations where it looks like you're going to be at higher risk, again, in crowded areas and public places that are indoors, attempting to social distance as appropriate. The CDC has released new guidelines about relieving masking measures when you're outside if you've been vaccinated, and depending upon who you're socializing with in terms of that small group of individuals, if you know they're all vaccinated. There are things we can do to get back to normalcy, but it really stems around those types of aspects of when it's going to be safer to do so. I think it's also interesting to note that our outpatient testing is just about identical to what Dr. Weiss said at Northwest. We're at 5.4% of all tests now done at BSA. Inpatient and outpatient are coming back positive for COVID-19. We finished April at 4%. In March, we were at 3.2%. So that number is obviously creeping up a little bit. It's still very low. And to put that in perspective, back in November, we had 34% of our tests were positive. So this is nothing like that. It's night and day compared to last fall. But those numbers are creeping up a little bit, with slightly creeping up numbers in the inpatient hospital census. And we need to be cognizant of the fact that we're not totally out of the woods yet. Hopefully, we're not going to see any kind of surge. And I think continued efforts to be aggressive about offering vaccination, to be aggressive about what we're doing to really try to maintain the health of our community are going to be important. And then lastly, I'd like to say that I'd like to give credit and a shout out to Mayor Nelson and congratulate her on her recent victory. We have been in very good hands with our city leadership over the past year and a half, at least with the pandemic is how far I'm going back. And my knowledge of local politics is not great, but I can tell you that the leadership during this time of the pandemic has been outstanding. And that really stems from many of our non-clinical leaders as well, who have been really helping us battle what we need to do to combat this disease. So thank you. That's all I have, David.
Thank you, Dr. Terry. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you for this time. So I'll start right off with our numbers. Right now at the Amarillo VA, we currently have 2 COVID patients, both in our ICU. Now, when I look at our positivity rate for April, we were at 2.2% for all of April. And right now, so far in May, we're just a little bit under 3% at 2.9. So, obviously, just like Dr. Lamentier said, much lower than what we have been in the past, but we continue to watch it and see those concerns. Our vaccination numbers, we've currently vaccinated 37% of our veterans here. And when I say we vaccinated 37%, those are 37% that I know have been vaccinated, whether we gave them the vaccine or the veteran provided us a copy of their card so we could document it in our records. I am sure there are more that have been vaccinated, but I can only count those that we've seen that proof. We continue to offer both the Moderna or 2-shot vaccination and the Johnson & Johnson Janssen or single dose vaccination here at Amarillo and at our Lubbock campus. Amarillo, we offer it Monday through Friday, 8 a.m. to 3 p.m. And then we've moved our Saturday clinics to just the 3rd Saturday of each month. So May 15th will be our next Saturday clinic, 8 a.m. to noon. You can do that by appointment if you call us at 806-355-9703, press option 2. You can schedule an appointment, but we also do offer walk-ins during those times. I do want to remind everyone, we are eligible to vaccinate any veteran. So even if you're not eligible for VHA healthcare, we can still vaccinate you if you are a veteran. We can vaccinate any veteran spouse, and we can vaccinate any caregiver of a veteran. And the only caveat I have to throw is they have to be 18 and over for 2 reasons. That's what we're allowed to take care of. And number 2 is both of our vaccinations are only approved through 18 and over. One of the things I want to highlight is tomorrow is National Nurses Day and the beginning of National Nurses Week. And the VA has recognized this as National Nurses Month, and many areas have said, you know what, it's the year of the nurses because of all they have done for this pandemic. And so I want to thank our one nurse on this panel. So Casey, thank you to you. But I also want to thank the nurses throughout our community, the panhandle of Texas, and especially those working here in the VA. I just want to say thank you for all you do, taking care of our veterans and taking care of our staff. And then finally, May is Military Appreciation Month. So just want to thank all those that are continuing to serve in our military, active, reserve, and guard. Thank you for what you do and for our nation. And with that, thank you for this opportunity to speak to my fellow veterans in the community.
Thank you, Dr. Gonzalez. We'll now go to members of our media who are in attendance. You have a question for an individual panel member or the panel as a whole, that's completely fine. Let's start with Kevin Welch of KFDA News Channel 10. Kevin, how are you? We'll go to Kevin Welch of News Channel 10. Kevin, how are you today? We will come back to Kevin here shortly. Let's go ahead and start now with Morgan Durden of KBII Channel 7. Morgan, how are you?
Hello, Dave. I'm good. How are you?
I'm fine, thank you.
So my first question, it was touched on a little bit during this call, but it's regarding the COVID-19 vaccine. What would your medical advice be to someone who is saying they are young and healthy and don't need the vaccine, or this vaccine got approved in a short amount of time and we don't know the long-term effects?
Well, I can take a shot at that. So I think that, as one of the physicians who's taken care of a lot of the patients who've gotten sick in the hospital and trying to understand how many of these individuals got infected, many times it was from other members of their family, unfortunately, who had become exposed and didn't even know that they were ill. And then they end up infecting someone who's very vulnerable. So, so I think that another portion of this issue is that you are protecting those people around you, even though you may not be most at risk if you're very young. Now, that being said, we've had some kids that have gotten really sick, and so it's not that that couldn't potentially happen either. I think that in terms of long-term effects, I think that you'd have to define what long-term is now. I mean, I think the doctors on this call were some of the first individuals to get a vaccine. I got mine on December the 15th, and so I'm 6 months into it, and maybe I'm a little bit grumpier than I was 6 months ago, but otherwise, I think it's really pretty safe. And when you start counting up the tens of millions of doses that have been given, that there's just far more evidence that supports how safe it is, as opposed to any type of particular side effect, either short-term or long-term. I don't know if any of the other physicians want to comment on that as well.
Yeah, I agree with Dr. Milton. I will say that Dr. Milton's grumpiness is definitely not from the vaccine. I can confirm that. We love Dr. Milton. No, seriously, the vaccine, why I would argue for a young person to get it, why my own children who are young adults, I advocated for the vaccine. They received the vaccine. They were anxious to get the vaccine, probably because I made them nervous about discussing all the potential complications that can happen. And in a general way, reading the medical literature, seeing what's happening in our community, there have been more than a few young individuals who have been severely affected by this disease, some who have succumbed to the disease. And you really don't have to go far to see that if you're watching the news and you're paying attention to what's happening around the world. I would also add that if you don't have some level of protection, whether that be from prior infection or vaccination at the very least, as this virus is mutating and becoming potentially more virulent, which means it can cause infection at a higher rate of transmission potentially, or potentially more severe disease, then you may be exposed to the virus at a very bad time. You have no immunity, and the virus has now mutated such that what we have to fight against it is not going to work very well. That's kind of the worst case scenario. So again, it makes sense if you have some type of severe risk of getting the vaccination based on your individual health circumstance. There's not a very good argument of how that would even work, because those individuals who have those comorbidities are actually the ones that benefit the most. But someone who's had potentially anaphylactic reactions, severe allergic reactions to vaccine products, there's some potential to argue why you wouldn't in those situations. But you have to really think about you, and unless you're living in a cocoon somewhere where you're not around anybody else to potentially get them sick, you're every day we're walking past somebody, we're close to somebody in a proximity that puts them at risk of transmission. And many individuals are on medications or have conditions, or just have the nature of their immune system such that they're more vulnerable to disease.
And Morgan, thank you. I would add one last thing is, people talk about what's the long-term complications of the vaccine, if there's going to be any. My argument is, What about the long-term complications of the virus? Okay, there are multiple examples of viruses that once we contract them, they remain in our bodies and put us at risk for cancer or other complications. So Epstein-Barr virus can put you at risk for lymphoma later in life. Okay, things like human papillomavirus causes cervical cancer in women. Or obviously varicella zoster, which causes chickenpox, can reappear as shingles many years later and make people miserable. We cannot say that this virus is not going to be in that same family of viruses that ultimately causes long-term complications. And we now see, we know this virus can affect the brain, can affect the lungs, and can affect the heart. Okay? And we've seen many patients who have developed a myocarditis where they come in and their heart is clearly weakened from the virus. It shows damage based on lab tests we do. And I cannot tell these patients that maybe 5 years or 10 years from now, you won't have heart failure from the results of that virus. So I'm hedging my bets on the vaccine. I think this is the cleanest, neatest, safest vaccine we've ever seen, based on the technology that was used for this. And I fear the virus. I fear the virus is going to have long-term implications for people who have suffered from the infection.
Morgan, I want to add, I am not a doctor, and I think these three guys have done an excellent job answering the question. But I would wonder, doctors, if it was okay to simplify the long-term answer like this, that we've been eating ice cream for decades. We know that it's safe to eat ice cream. So when my favorite ice cream store comes out with a new flavor, I know it's still okay because the process for making that ice cream was basically the same. They just added a different flavor to it this time. So I know that's not a medical sciencey answer to it, but how do we know this is going to be okay long term? I love what you said, Dr. Weiss, about, well, we know less about the virus. We know a lot about vaccine technology. We've been using them for decades. So like ice cream, we know it's safe. We've been eating it our whole lives. This is just a different flavor of a well-known, well-researched product that I think not hearing the science words behind it actually helps me understand it. So there's another version.
Thank you all for your information and input. My second question is, representatives of Pfizer spoke yesterday that they plan to file for full approval of the use of the vaccine beyond the emergency use that it has right now. Can you explain the difference and why this is a motive or goal?
So that would just change. I mean, it doesn't change the vaccine. It doesn't change the efficacy or the safety of the vaccine. It just means that it's gone all the way through the process, and now it has the full licensure. So kind of like Mayor Nelson's analogy, like it's a certified like Bluebell product. Like it's got full licensure under the FDA, and so it has that full stamp of approval. So it doesn't necessarily change the product or change how we're going to give the product. It just has that full licensure, just like many of the other vaccines, the Tdap vaccine, the varicella vaccine, some of those other vaccines that we have had for so long and kind of known and become so familiar with. And so I think it's a great next step and a very needed next step in the process.
Great, thank you. And then I would just like to ask, so as we have more events and open up, Hodgetown, for example, is increasing their fan capacity starting this month, I believe, for their home opener. Is it time to start having events like this?
So like Dr. Lamontier said, it's important to be smart. We got to be vaccinated. If you're sick, you can't go. If masking is always important. So just like Dr. Lamontier said, we've got to be smart about it.
And Morgan, I would say these events will only get safer the more people are vaccinated. Right? In that stadium, if we've got 80% of the people in that stadium vaccinated, that's going to be a very safe event. And I know the folks at Hodgetown have been giving us lots of consideration on how to keep this safe. They put up safeguards and are asking people to wear masks in the public area. So they're doing their best to try to give us a good season and keep it as safe as possible. But if we want to do our part, then we need to get vaccinated. And if we can fill that stadium full of vaccinated people, then we can all enjoy those events and not worry about it.
Great, thank you. That was all I had today.
Thank you, Morgan. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you?
I'm good. How are you?
Good.
First question is, with the increase in cases we're seeing, are we seeing pockets of exposures and positives, or is this just kind of random spread everywhere?
So it's a little bit of both. Whenever you have large groups together that have reduced masking and that kind of thing, we definitely expect to see an increase in cases and an increase in exposures, but we also have kind of more general spread. So I would answer that with a little bit of both.
All righty. And we keep hearing that some people have limited to no reaction to the vaccine, and some kind of get knocked out for a day or two. Are we seeing any trends that might indicate who's more susceptible to be hit harder by the vaccine?
Every body is just a little different, and so your immune system's kicking in, so you're probably you can expect a sore arm. I made sure to get my vaccine on the side that I don't sleep on, so that when I roll over on that side, it didn't hurt. But other than that, I think every body is a little different, and so every body may react a little different. I think the side effects that you could expect with the first shot are similar to the side effects that you expect with the second shot. I think it's important that people aren't scared away from that second dose. It's important that people get their second dose of either the Pfizer or the Moderna vaccine. We hear and whatnot that second dose may be worse. It's not always, and so it's very, very important that people get their second dose to recognize that full effect of the vaccine.
Hey, Aaron, I would just say, I got some shaking chills the next day, and I was pretty stoked about that, going, aha, I'm reacting. For most people I've talked to, that the side effects or ill effects last for no more than about 24 hours. But what was interesting is we kind of did the experiment in Northwest where we had several of my colleagues who had no reaction to the second shot. And they were worried, gosh, maybe the vaccine's not working for me. So we did test a bunch of people's antibodies about a week later. And one of the people who had no reaction to either vaccine had the highest level of antibodies out of all of us. So clearly, whether or not you have a reaction or not, you are still going to react and have antibodies from those vaccines that are so effective.
All righty, thank you very much. And real quick, Dr. Lamentier, do you happen to have the number of COVID patients in ICU and on vents?
Yes, I do. Out of the 21 that we have hospitalized, 12 of those are in the ICU, and 6 of those patients are on the ventilator at this time.
All righty, I think that's got me covered. Thank you very much.
Thank you, Aaron. Let's now go to David Gay of the Amarillo Globe News. David, how are you?
There we go. I'm doing well. Hope you guys are doing well. I guess my first question is, are there any reported cases in the Potter and Randall County areas, COVID-19 cases for those who have been fully vaccinated?
The answer to that for us is that yes, we know of a small number of cases of individuals who have been infected that have been vaccinated. That has been a extremely low number that have actually translated to a hospitalization. And when I've looked at those cases, it is because those individuals unfortunately had significant comorbid illnesses, meaning other disease processes that cause their immune system to be suppressed. So theoretically, that means that when they were vaccinated, they probably did not get the immune response that they needed to get as a result of the vaccine. And even if they did, they're more at risk for getting infections because of that innate difficulty and abnormality of their immune system. So again, the answer there is very, very few.
David, I would say, same as Dr. Lamentier, unfortunately, we had a couple folks that got infected right after their first dose. So they just kind of couldn't cross the finish line there. But I don't think we've seen anyone yet in Northwest that got the second dose that's gotten the virus. But yeah, we had a couple that in between doses got sick.
Absolutely, absolutely. And I guess the last question that I have is, I know that the public health department is based out of Amarillo, but through I get reporting cases from both Potter Randall counties, obviously there are parts of both counties that are outside the city limits. So I guess my question is, are there any plans for, I guess, the public health department to host mobile clinics outside of the city limits, whether it be in Canyon or outside the city limits in Potter County in some place?
So we're certainly working with all of our different partners. So we've talked with the folks in River Road. We're working with folks in Canyon to support them in clinics. So definitely more to come on that. But for right now, the clinics, we've got the clinic schedule, and then if there's a special clinic, then we'll certainly let everybody know.
Absolutely. That's all I have. Thank you guys. Have a good rest of your week.
Thank you, David. Let's now go back to Kevin Welch of News Channel 10. Kevin, are you there?
I'm here. Sorry for the unforced error.
That's okay.
So, Mayor, is the city approaching the threshold where the leaders are going to talk about reducing hours at the Civic Center?
Reducing the vaccine clinic hours, Kevin?
Yes, yes.
Well, I'll tell you that conversations are happening all the time about how to adapt every model we're using in order to meet the needs of getting more people vaccinated as quickly as possible. Sometimes I'm asking questions and participating in those meetings. A lot of times Casey and her staff are seeing on the ground changes that need to be made. So Casey, do you have comments you want to make about that?
I would say that we're actually increasing hours. So the Civic Center hours are remaining the same, but we're offering clinics out in the community. So our offering of hours is actually increasing.
Okay. And Casey, can you tell me approximately how many patients the about 3% hospitalization rate represents in the TSA?
Yeah, so I looked, the DSHS website has a dashboard that has that information. So yesterday when that was updated, it's about 28 patients. It's important to know that that's a snapshot in time. So when all of that information is collected, so that was like one moment in time. So the hospitals may report different numbers because they're looking at a different snapshot in time when they, count their information. But as of yesterday around 4 o'clock, it was 28 patients.
Okay. And Dr. Weiss said that their patient hospitalizations like 1% or something like that. Is there someplace else in the TSA that's driving that up to 3% besides Potter and Randall?
Right, so it's the entire TSA. So it's about a 25 county region. So it's all of the hospitals in that 25 county region that are contributing to that make up our hospitalization rate that's defined by the state. And so it would, if there's 927 beds and 3% of, 28 people are in those beds, then that would be at 2.94%. So that's a calculation that DSHS makes based on information that's inputted to their system.
Okay. And what's the demand like for testing at the city site?
It's fairly steady, so definitely lower than what it was in the summer and even into the fall, but we're staying fairly steady, so we're able to make appointments for people to come be tested. And we've moved that site over to the public health department, so we're able to test people just out of the health department. So they're able to drive through there at the health department and we'll test them. But so I would say steady, but definitely we're seeing a lower demand than we were back in November and different months. So we're glad to be there and be able to test people.
Right. And Mayor, has the state notified the city that it's going to be rerouting any vaccine doses to areas of more demand? Are we at that stage?
Nothing that I'm aware of. Casey, do you have any change in communication from DSHS about vaccine distribution to Amarillo?
No, we're able, so that they did change the model. So it was more on an allocation basis, but now it's more on an ordering basis. So providers are able to order the vaccine that they need week by week. And so we can, we're able to order the vaccine that's needed. And so I don't think it's, they don't need to stage vaccine really, because we're able to order as needed.
And I assume based on demand, we're ordering less than we have in the past.
Yeah, we're not needing to order as much just because the demand has gone down and we have a little supply.
Okay, that's everything. Thank you all.
Casey, I have a question for you if you don't mind.
Sure.
I know that part of what I'm hearing the doctors say is it's really good to get vaccinated because it protects your health. But I'm just thinking about it from a mom's point of view. It's just also more convenient because then we get to skip all the hassle of COVID protocol and all of that. So if the family is kind of on the fence of trying to decide, do it, don't do it, talk to us a little bit about quarantine protocol right now. And I have had some citizens reach out and say, why is my child needing to quarantine? Why is the public health department quarantining perfectly healthy children? So talk about quarantine protocol and why a vaccination could actually help you on the convenience side about addressing that.
That's a great question. So we don't quarantine healthy children. We quarantine children who have been exposed to a positive case. So those kiddos are potentially incubating the virus and could become positive at any time within that 14 days. And so I think that that's a really important piece of the puzzle. It's also important, like right now, the vaccine just isn't available to kids under at the age of 16. And so if someone is fully vaccinated 2 weeks after their last dose of vaccine, so the first dose of J&J or the second dose of Pfizer Moderna, then they would be eligible to basically skip that quarantine if they're fully vaccinated. It's like we heard the hospital say, BSA doesn't have anyone quarantined, or maybe vice versa. And, Northwest has very few people quarantined. I can't remember exactly who said what, but there's very few staff at the hospitals that are requiring quarantine because many of them they're vaccinated. And so I think that is, again, one of the pieces, one of the pathways that we go back to normal is to be vaccinated. I know as a mom, I am super excited for my kids to be eligible to be vaccinated. We don't quite have 12-year-olds yet at our house, but as soon as the vaccine is available to kids younger than that, then mine will be right up there rolling up their sleeves to be vaccinated, because I don't want them to be sick. More than anything, I know the quarantine is so inconvenient, but I don't want my kids to be sick. I don't want my kids to spread disease to my grandparents or to other loved ones or to their classmates. So I'm super excited about the vaccine and that, expanding down to kiddos younger than 16. So I know as a mom, I'm excited. As a public health professional, I'm very excited. I know this is the way that we're going to move forward. And so I think it's safe.
Thank you.
Thank you, Casey. Those are all the questions we had from media. This concludes our news conference for today. Once again, this is David Henry. I'm Communications Manager for the City of Amarillo. I want to thank all of our panel members who joined us today and provided this important information to the community. Thank you.
Thank you.
Thank you.